Hi, I'm Doug Kimball, the marketing advisor to Red Sky Health. I'm joined by Jay Pillai, the Chief Operating Officer of Red Sky Health, and we're going to talk a little bit about what it is that Red Sky offers to healthcare providers. So, Jay, thank you for being here. I appreciate your time. Let's jump right in. I think a lot of people are still learning who Red Sky Health is, what they do, how they help. So, if you could just give me a short summary of what is it that we are doing to help healthcare providers solve for? What's the problem we're helping to fix?
Well, Doug, as you know, in the healthcare industry, we process about 4.5 trillion claims on an annual basis. And approximately, we have about 15% of denials. As someone who actually worked for the insurance industry for close to 2 decades, I can tell you with high degree of certainty that this percentage of 15 to 20% has not actually decreased. In fact, it has increased over time. So clearly, the problem that we are trying to solve is one of how do we get our providers to focus on care, which means getting them off worrying about getting their claims paid, freeing up their time so they render the services where the services are needed most. So our objective is essentially to remediate these denials by getting them right after we identify them. And that's what Red Sky's mission statement is.
Denial is taking care of that. It's an amazing how we don't really realize how much of a big problem that is until we experience it. So when you look at that, remediation, what's the value that a healthcare provider is going to get by working with Red Sky Health? Where do they see revenue numbers?
So there are a couple of different avenues for that. Firstly, if you start looking at what a provider or a hospital, large-scale provider or a hospital does today is they have a ton of people. All they do is sit around, look at those denials, try to understand the root cause of them and remediate them. This is a business that is plagued by a high turnover. So you've got really inconsistent approaches to remediation. So now you've got a scenario where you've got delays in how cash comes in. Extremely high labor-intensive workforce, high attrition rates, a very inefficient process because you've got to resubmit those claims over and over again to get paid. And it's at the same time, you're getting denials on an ongoing basis as you continue to see patients. At some point, you give up on it. So the value that we bring to the organization is we leverage AI/machine learning to, on a close to real-time basis, we not only identify the root cause, we remediate the problem. We tell exactly what needs to be fixed. So with one resubmission, the claim gets paid. And then the provider, all they have got to do, focus on their members, reduce the number of FTEs that worry about claims denial remediation, cash in the door faster, a very streamlined, efficient process. That's our objective, consistent with what Whitest hospitals have.
And then machine learning is really one of our key differentiations. It takes a lot of the error out of the process. It takes cost out of the process, and it speeds everything up, if I understand properly.
Absolutely. When you start thinking about what these hospitals and large provider organizations want, they want claims to be paid timely, accurately, and consistently. That's exactly what this algorithm does. You get these claims, literally the recommendations are made close to real time, which means there's no human interference. The algorithm basically is trained to understand the root cause and tells exactly what you need to remediate. And you can have a human being remediate it, or we can programmatically remediate that claim and resubmit it back to the PMS system, or ultimately at some point down the future to the clearinghouse.
Great. I guess the easy question is why start now? Why should a provider jump on this right now as opposed to waiting until next quarter or next half?
The providers have nothing to lose. The model that we've got in place is one where if there is any savings to be gained, our revenue stream comes off the savings. So literally on a pro bono basis, we'll develop the business case, we'll actually develop an optimized model, we'll run it against claim denials, we'd point to what it takes to remediate the denials, and we could essentially remediate them on behalf of the provider as well, show the real savings. So fundamentally, with minimal effort, we should be able to actually generate revenues right after they transition to Red Sky Health on a short-time basis. So that's the true value add. Secondarily, we can also identify incremental revenue streams because we are privy to the historic and current claims data. We can identify members with chronic conditions who are not being seen by the provider. We can identify members with perhaps behavioral health integration issues, members with remote monitoring devices. So all other sorts of incremental revenue generating opportunities can also be identified. So why delay those earning streams?
Low risk, high gain, improvements in patient outcomes. It seems like a win to me. So, all right.
Absolutely.
Jay, thank you very much for this. If people have questions, reach out to us at redskyhealth.com. We'd love to get you on board. Thank you.